All right, welcome everyone to our Q&A today. My name is Charity. I'm a Senior Presidential Director with LifeWave. Today is September 4th, 2024. Cannot believe it's already, the year is zooming by. Everybody thinks summer is over, but I'm not saying that. I still am going to stay in the vein of summer and enjoy the warmth. So anyway, welcome. So today is our Q&A where we encourage people to bring your questions. Most of the times we'll have an answer. If not, we will get the answer and get back with you. And these questions can be business, patches. Although we are not going to diagnose, treat, cure, prevent diseases. We don't do protocols. We just tell you about the technology and what we've learned from David. But Dr. Dolly Lowe is with us today, and she is also a director, senior director, sorry about that, Dolly, with LifeWave, working her business. And she's been using the patches for several years, uses them with her clients, her patients. And but today, she's going to talk about Aeon. And we all know that our flagship product is X39. That is the number one product that we talk about because that is the one that's activating your stem cells. We don't have any other patches that activate your stem cells except X39. So, but when we set people's accounts up, there is a reason we like to combine it with the Aeon, okay? The A is silent, Aeon. And a lot of people don't really understand why we like that. So Dr. Dolly is going to give us some of the background and from a clinician why that Aeon is so powerful to couple with the 39, okay? Now, what she's going to tell you, there is so much more to that Aeon than even what she's going to tell you. And I'm just going to tell you right up front, she may, and she'll probably say this also, you will not find, I've heard David talk about it twice in 3 years on a private group. You will not find what peptide that activates for reasons, because it is a very, very, very powerful in what it does. All I'm going to say is, as David, I will never be without the 39 and the Aeon. So Dr. Dolly, welcome, and thank you for joining us today and coming and sharing a little bit about the Aeon and why we love it and just a little bit about it. So just take a minute or two, tell people who you are and what you do.
Thank you, Charity. Hello, everyone. So once again, I'm happy to be here and to be having the opportunity to talk about the wonderful patch that is Aeon. So I am a doctor by training. I am a chiropractor, but my area of interest is bioenergetics. So that's what I sort of specialize on. So I get to work with people updating their nervous system, which that's one of the reasons why I love Aeon so much, combined with the X39. So we do that and we're able to do it. So we help people physically, mentally, emotionally, chemically, and spiritually. Why not? So it's a great combination. So I've been in practice for about almost 30 years. I'm coming to you from Fort Worth, Texas. If you hear my accent, you'll think like, that's not a Texas girl, which I'm not. I've been half of my life here in Texas, but I was born and raised in Puerto Rico. My first language is Spanish. So anyway, so I get to share in both languages, which I love, and teach as well. So the information that I want to share with you, like Charity said, there is so much more that what I'm going to touch on today regarding Aeon. But we don't have to know everything there is to know about Aeon to be able to help someone out, okay? The purpose of the next 10 minutes or so that I'm going to be talking to you about Aeon, for me, is that this information is for you first, for you. Because a lot of times you go like, let me take a lot of notes so I can tell this other person and I can share it. No, let's start with this information is for me, okay? Because if I have an understanding and I have an experience that is mine, then whenever I speak to someone, I'm gonna speak for my confidence. I'm gonna speak from my sense of belief. When I speak to you, I speak to you not only from data, of knowledge, of books. I'm speaking to you from years of what I've seen. And I've seen things that, that I would think sometimes, like, if you had only seen what I've seen, you wouldn't even be asking me that question, right? So sometimes we can speak to people from that space where the questions are not even necessary, because some people come to me and say, well, what do you tell them when they ask about this? What do you tell them when you ask it? How can I explain? And I said, well, I don't get those questions. Okay, I don't get those questions. Oh, well, I don't know. So very simple. First of all, just so you get an idea, being a doctor and everything, I'm not a fan of flooding people with information and data, because it doesn't work. Long time ago, I learned from a dear mentor of mine that the power is in the story. When you tell a story, stories are remembered and they're retold. Okay, so people will remember a story. They are not going to remember statistics. They're not remember clinical studies. They're not going to remember the experiment. But if I tell you the story of what this did to me or to my loved one, you're gonna store that somewhere that you're gonna be able to access it and share with someone else. Because my doctor, my friend, my neighbor told me that this happened, or did you know that I saw this story? So that's the most important thing, to cover the basics. Now, to start from the beginning, Eon, right? Love it. Eon, the name Eon, where does that come from, right? Let's start there. So when we talk about Eon, we're talking about time, right? Like a really long time when we talk about eons, right? There's a reason why this patch is called Eon, because it has so much to do with lifespan and health span, okay? So when David Schmidt came up with this, and they were trying to find out, okay, so what are we gonna name it? Then they decided on that, because of the benefits that they saw and they knew about, of what it does directly to increase not only your lifespan, which is how long you live, but the health span, how healthy you live. Because who wants to live to 100 miserably, right? So that's why it's called Eon, because it has that benefit that we're going to talk about. And then combined with X39, like Charity said, this is the one that's going to activate your stem cells. But this is a great combination here that I love. And the main reason, in a nutshell, X39, it activates your stem cells, and you know the benefits of that. Eon, it's going to do two main things: decrease your inflammation in your body and help regulate your nervous system. Two key things, right? Pretty much that's what I tell people. I don't go beyond that, unless some people are more aware of what chronic inflammation does in the body and this and that, and then we can have a conversation about that. But when I recommend this to someone, I'm gonna say, you know what? In order to boost and to help increase the benefit of this, my recommendation is that we combine it with this one, if at all possible. Why? With Eon, because we want to decrease inflammation, which is so important, and we want to regulate your nervous system, which, if they're talking to me, they already know about the nervous system and the importance of a balanced nervous system. Okay, so in a nutshell, that's pretty much what you need to say. Now, what is the knowledge that you're going to have that when you say it, it's going to resonate with people? Your voice, your words, your intonation, your body language is going to be one that says, I believe her, or I believe him. There's some weight behind those words, So there's got to be something to it. So I'm going to listen, and then I'm going to pay attention. I'm going to follow it. And therefore, I'm going to benefit from it. Therefore, we all win. And that's what we're looking. We're looking for all of us to win. So we talked about the lifespan. It helps you live longer. It helps you live healthier. It extends your life. So therefore, we're not talking about anti-aging. We're talking about age reversal, which is so important. And there's a big distinction. We're not stopping the aging process. We are reversing the aging process. We're not just looking better. We are being better, okay? So that's very, very important. Another thing that's very important, which sort of has to do with what I've already spoken about, is mindset. Mindset is critical. Why? I'm going to quote Dr. Joe Dispenza, one of my favorite speakers, which always says, remember that your body follows your mind. The body follows the mind. So you want your body to change, you got to change what you're thinking, and you got to change what you're feeling. So you got to change your beliefs and attitudes and perceptions about recommending this combination. Let's start there, okay? That's the first step to success. If there's any type of hang or doubt or whatever, this is why we're talking about it, because this is going to help you convey that from that standpoint of my mindset is already in alignment with the information that I'm going to be sharing. Very, very important. In healing, we know that that's one of the things that we deal with to help people maximize their own ability to heal, is to change their mindset, to change their perception. If you don't believe you heal, and if you don't believe that you can heal where it counts, which is subconsciously, then you're going to spend a lot of energy, time, and money in the pursuit of health and healing. So that's really, really, really important. There are so many clinical studies that have been done with thermal imaging, with infrared, with medical infrared imaging, that can show how when you place the Aeon patch on someone, just the Aeon patch, within seconds, you start having a measurable change. And within 20 minutes, is remarkable how all the inflammation markers start going down in the body. So why is that important? That's very important because that would be a wonderful complement to your X39. Because if we know anything about inflammation, or the one thing that we should tell people about inflammation, is that it's the #1 enemy of your stem cells. Okay, so your stem cells are attracted to inflammation wherever there is inflammation in the body. Why? We talk about inflammation as it's a bad thing. Inflammation is a really good thing. Out of control inflammation is not such a good thing. But the inflammatory process is a very beneficial process because it's part of the healing process, right? When it gets out of control because we have an unbalanced nervous system, then it can become a problem. It starts helping until it doesn't, and then it starts interfering with the healing process. If we're not supposed to have a constant response of inflammation in the body. So that's what we call chronic inflammation. That's a problem. So we want to be able to modulate and regulate the inflammatory process as it's needed, like anything else in the body, right? You don't want systems turned on when they're not supposed to be turned on, because now you're stressing your body out, okay? Now you're creating a timing problem in your body where you're doing a right thing at the wrong time. And then a right thing at the wrong time becomes a problem that your body now has to try to overcome, and spend the energy trying to overcome a problem instead of healing whatever needs to be healed and regulated in the system. So to bring the inflammation down, we can use Eon to do it more effectively than most of the things that are out there. Okay. If we combine the X39 with the Eon regularly, like every day, like I do, then you're helping, because we know that we all have some degree of a chronic inflammation going on in the system. Most people do. And people with chronic degenerative diseases, what's happening there? There's inflammation. People that have persisting symptoms and conditions that are not healing, what's behind that? Most likely a chronic inflammation. So who can benefit from Eon? Everyone can benefit from Eon. Short-term benefits. The great thing about Eon is that you have benefits in the short term and in the long term. In the short term, it's also going to help you decrease pain, because if inflammation goes down, a lot of chronic pain comes from chronic inflammation. When we start reducing the inflammation, the pain starts going down. Now the pain starts going down, your mind starts working better, because someone in pain doesn't think as clearly, doesn't sleep as well, doesn't have the ability to focus. It's easier for a person to go negative in their mind when they're in pain than when they're not, right? So meaning that it's more difficult to be of a positive mindset when you're in pain. And there's a lot of people walking around in pain, okay, used to their pain. So we can start helping that by, helping with Eon and combining it with the X39. The other benefit is that it decreases pain, it decreases inflammation, because it starts working on your autonomic nervous system, which pretty much is the part of the nervous system that has two main branches. It's got three, but let's talk about the main two that we all know is your automatic nervous system. You have the branch that revs you up, that we call it accelerates everything. That's your fight or flight, your survival response. And then if it has the part that sort of slow things down, which we commonly call your rest and digest. Those are the things that when they're functioning properly, they keep you alive long term. Your fight or flight system, which is, your sympathetics, are meant to be activated when there's in the presence of an immediate threat to your survival. Is your emergency system. But what happens when we walk through life like everything is an emergency? A lot of people, a lot of us walk around like every little thing that happens is life or death. Emotionally, we think that way. What's the problem? That you cannot separate your emotions from what your body's doing. And if we know people, or we are the ones that have a pattern where we live like everything is an emergency, everything has to happen now. I want everything done now. I am a workaholic. I am a control freak. I am a perfectionist. Guess what? Great, your body's paying a price for it. It has no choice but to pay a price for it, because it will immediately react chemically to whatever you're thinking and feeling, and to your attitudes and your beliefs. So that will throw your nervous system out of balance, because now you're activating that fight or flight mechanism that's only there for, when the dog is chasing you or the bear is chasing you out of the woods. When there's immediate threat to your survival, if everything is a threat, then that you don't give a chance to that system to turn off. And because the body learns so well, then it stays on just to help you out. So if it's doing that, it can be doing the other, because if you're surviving, you're not healing, right? You cannot heal to your maximum capacity if you're living life like it's an emergency. The body cannot do those two things at the same time. It will always choose to keep you alive, not to keep you healthy, okay? It will always choose life, survival. So Eon will help those people regulate their nervous system, starts regulating that system and bringing balance between that part that's always revved up and you're like, your RPMs are like way up here all of the time. And that's why you don't sleep. And that's why you have digestive issues, right? Because the body over here is going like, no time to digest, no time to sleep, because we have to be on guard. So now Eon starts balancing that out. So it starts slowing things down, allowing this to rev up. So now a lot of people will tell you that when they start using Eon, they start sleeping better. That's why. A lot of people, when they're using Eon, they will tell you, my gut feels better. That's why, okay? Because of the inflammatory process. And then this is what's happening. There's this balancing happening where your revs are going down and the other one is coming up. And now there's a balance where now your body has the flexibility to, in real time, react to whatever is needed. Okay, so if there's a little bit of an emergency, we need to turn this on. If there's not an emergency and it's time to rest, then we need to lower this and bring this up a little bit. If it's time to sleep, then we can bring the parasympathetics up a little bit. So now you can have a good night's rest and your body can do some maximum healing at that time. So this is what Eon is doing when you just put that patch on. And it's also, because it's going to do that, it's also going to has another benefit, immediate benefit, which is that it's going to activate your primary, or they call it sometimes primitive, immune system. So the very basic foundational aspect of your immune system that if you are in emergency mode, is not going to be able to activate as it needs. So when you start using Eon regularly, now you're going to have the benefit of your primitive nervous system being active, immediately active. Also, what's going to happen when all these things happen is that your primary antioxidants in the body, their levels are going to start coming up, like superoxide dismutase, SOD, like glutathione also is going to start coming up, and you're going to have increased levels of that. So that means that you're reducing the oxidative stress in your cells as well. So now you're winning and you're balancing that nervous system. So it's very, very important, because people that are emotionally stressed out because of their work, their life environment, their own personality, whatever it is, Eon is going to start helping. Okay. It's going to increase longevity. And another and very interesting fact, there's in one of the, when I first started with LifeWave, they gave me like this sheet that's got the description of different patches. And in Eon, it says something, it talks about royal jelly and a comparison of eating or consuming royal jelly and all of that. This is how important this is. And this is how good this is. And, you know, the wholesale of this is what, $69.95. Let me tell you something. This is, I just recently found this out and I thought, yeah, that's it. I mean, this fact that I'm going to give you now is enough to just speak with confidence about it and tell people you need it, and I'm gonna put it in your order. One of the things that we're studying, and it's the basis for David's research and this peptide, is that one of the things that were studies were queen bees. And the queen bee lives 60 times longer than the worker bee, right? What's the difference? The queen bee consumes royal jelly and the workers' bees don't. What happens is that there's a scientist that found that there's a peptide that facilitates the queen bee living 60 times longer than the worker bee. That's related to that royal jelly. So then he was thinking, okay, so how he found that out is that he injected some of that into a worker bee. The worker bee was able to live not quite as long as the queen bee, but a whole lot longer than regular bees. So than the other workers bees. So what happens? We produce this peptide in our liver. We do, we have it. It's in our liver. So, but what happens, just like with the stem cells, by the age of 30, it starts being decreased in the body. We don't produce as much of it. So, but then the scientist was thinking, well, it would, if we found a way to sort of like isolate, inject, or make a supplement or with this peptide, in order to have the concentrations that are needed, they're massive concentrations that a human being would need, and they would have to last about 20 hours in the system. And in order to do that, they calculated that it would be really, really hard to do, and the cost would be about $50,000 per month for you to get that in your system. $69.95.
Wow.
Wholesale price. Okay, for a whole month. So 50,000 or $69.95. You don't have to inject anything. You don't have to go. It doesn't even exist because there's no point in trying to make it because it would be too difficult. Okay, so David figured out how to get your own body to produce the peptide, because guess what? We already produce it in our liver. Okay, so this is stimulating our own production of our own peptide. So it's not something, it's not a B peptide, it's our own peptide that we're increasing, because after age 30, we start having less and less of it. Okay, so that right there to me is just like, okay, I'm in, let's do it. Aeon will increase this peptide, it'll control your inflammation, it'll decrease the oxidative stress, and then your cells start becoming more coherent. And that's a word as a chiropractor and an energy practitioner. Coherence is one of my favorite words. If there's coherence in the heart, there's coherence in the brain, and there's coherence in your cells, you are living a healthy, productive life. So what the body needs is coherence. So Aeon will produce that. So now, this is the reason why this is such a great combination. Aeon and X39 together to increase, and I tell people it'll help boost and help your X39 work even better. So you're protecting and you're expanding on your investment. So it's a win-win. And that's all I have to say about the beautiful benefits of Aeon.
Oh my goodness, Dolly, I get so excited because of what you laid out for the Aeon, because we know it's about inflammation, but there is so much more. And when, and I tell people, who do you know that is not stressed or inflamed these days? Well, I have not had one person tell me one person that is not under stress or inflamed, and they'll go, well, everybody's stressed, everybody's inflamed. And, inflammation is a big, big deal, but stress is such a big deal. And when you can start to balance that autonomic nervous system, like what you said, and I hope that today that maybe some of you that are on the call and on the Zoom maybe didn't really understand that, how the autonomic nervous system works and why it is so important to your health and healing. When you can calm those switches back down to more an even template, so that when the bear walks in the room and you go in fight and flight, you're actually in fight and flight, and then the bear leaves 20 minutes or leaves, and 20 minutes later it all balances back out how it should be. That is a big deal for your stress or your health. But when your body is always in fight and flight and there's no bear in the room, but it's stuck on, that's when your body will break down, and that's when disease and sickness, it will not heal. And you can do everything, but until you get that nervous system balanced down and the stress down, will then the body really start to kick in and heal. And that's why another reason why I wanted you to come on and share today, because if you all can start understanding the power of this Aeon with the 39, David said this in research in the clinical studies, that when you combine it with that 39, this is clinical studies, it increases the effectiveness of the 39 by 30%. That's another big deal. So, we love it. We put it on in their package. We put the X39 on auto ship. If you're doing let's just say one person, you're doing a silver pack. So I would do one X39, 4 Eons, put the 39 on an auto ship. Now for the next 4 months, when you get that auto ship, you're going to have those 2 patches for 4 months. And what a great start for that person's wellness and to make huge differences. You're bringing inflammation down, you're bringing the stress, you're bringing the autonomic nervous system into balance. And I know we cannot talk about what that peptide is, but it does so much more than that. And I just get really, really excited. And you know, some people call it the happy patch. You know, I've talked to people a couple years ago when I started working this business and sharing it with people. And, you know, these people were just not happy people. You know, they were just every time you talked in there, just, you know, everything was dark. Everything was gloom and doom. Everything was, you know, they never laughed. They never smiled. They were just, you know, kind of them gnarly little personalities. And I remember 2 people, and they even said, I don't know, one said, I don't know why I'm so happy today. And I just had a chuckle underneath my breath because they were doing X39 and Eon. And they, you know, I'm thinking, I'm glad they recognized it, you know? And then the other person, is actually related to me, never was happy, never laughed, never. And I was talking to them and they were laughing, and it was just such a joy because you simply see life change, not just from a health perspective, but overall. And it just brings so much joy. So yes, we could talk about this all day, but I would like to, we're going to open it up for questions. If you have a question about the Eon right now. So if you have a question concerning the Eon, or maybe you know, have a question for Dolly about that, then raise your hand. So Barbara, we're going to go to you first. I think you had your hand up there. So what is your question?
Yeah, so the question about Eon, somewhere I read on one of the Telegram channels that it's best to wear the Eon either on the midpoint or the right side of the body. But if somebody's experiencing inflammation, like let's say in their left knee or left ankle, does it really matter if it's on the left or right side of the body?
No, it doesn't. If somebody is experiencing pain, anecdotally, we know that if you place the Eon at the point of pain, it'll start working faster in that area. So it doesn't matter if it's right or left. In the absence of pain, then we want Eon in the midline or the right side of the body, because it has to do with acupuncture and how the energy flows in the system. But no, you can put it anywhere where there's at a point of pain. Doesn't matter if it's in the left side of the body. I would go ahead, and if it's my left knee, just put the patch on the left knee. If you hurt yourself, injured an area on the left side, put it on the left side. Sure.
But if it's not pain, but like, let's say, like my mom said, she's always got swollen ankles on her left foot. Would you still do it on the left, or is that generalized and you'd put it on the right?
If both ankles are swollen, that's more of a systemic thing, and we're not diagnosing or anything or treating, right? But then I would go with midline. I would go under the belly button, just because that's a whole body thing. Even if it's you're looking at the ankles, that talks about something going on systemically. So
But
then
if it's just her left ankle, she could put it on her left ankle.
Yes, and see how that works.
Perfect.
You know,
thank you.
Dolly, can I say one more thing about that? Because we're talking about the left and right side. And if any of you are in energy medicine, energy work, that type of thing, you know, and I know that there are some patches out there that work with the electrical, let's just say the electrical currents of the body, or the energy flow of the body. Okay. So, you know, experiment, you know, if you're putting them on the left side, you know, and you're like, oh, you know what, after a week, nothing, put it on the right side, because sometimes our current in the body is going opposite what it should be. And so, you know, but here again, the only way you can patch wrong is by leaving on the counter.
There you go. I like that.
Sonia, question for Dolly. You're muted.
Sorry, it wasn't letting me unmute. Okay, so you mentioned that to wear the Eon, it would increase the effectiveness of X39 by 30%. My question is, do they have to be worn at the same time? Because I typically wear my Eon at night at bedtime.
Yeah, and that is fine. I personally like to wear them both at the same time, but you don't have to. Because of that, I have a lot of patients that they feel that it helps them relax and sleep better, so they prefer to wear the Eon at night, and that's perfectly fine.
And
Thank you.
I'll piggyback on that too. Remember this, that you have that patch on, it's starting to activate that peptide. And so if you wear it in the evening and you wear your 39 during the day, it's working, right? So when you put that X39 on, it's helping with inflammation. It's helping with the autonomic nervous system. It's working. So yeah, a lot of us like it at night. David likes it at night because, again, of what Dolly said, helps the body to rest and relax. Yeah.
Thank
Margie.
you.
I was thinking to introduce and out of my own pocket to the family, let's say a Christmas gift for everybody. Do you see any issues with just starting them on Eon? Giving them Eons? I get 3 of them for $149.95, and I'm thinking, you know, can you imagine? They could feel a peace. I've seen it stop seizures right away, but I'm not doing it for that. I'm thinking I feel good with Eon. They're younger people. Your input, please.
Yes, that's Eon will do all this stuff that I talked about independently of the X39. Remember, the X39 hasn't been around for that long compared to Eon. So back then, they were having incredible benefits just by patching someone just with Eon. So yeah, that's going to be a great benefit. And another thing is that for your pets, which here's my Candelita, which I patched up this morning. She's got X39 and Eon on her, wrapped around her collar here, and she's doing great. There's I saw these pictures that on a webinar David showed about this 30-year-old horse that was in really bad shape, and the owner, who was a doctor, she decided to just place 1 Eon a day on this horse, and 30 days later she's got a brand new horse. It's unbelievable, and the before and after pictures are just impressive just with Eon. They actually did infrared thermal scans on the horse, and 20 minutes later the inflammation all over the body had decreased dramatically, and the temperature around the heart increased, which is what we want, because that means that there's better blood flow, and the heart is able to maintain the blood temperature, you know, heat up the blood as it warms up the blood as it needs to. So yeah. So also let's think about our pets too.
That's good. And could you just say the forbidden peptide, is that the same peptide that we've mentioned before, or could this possibly be a different peptide?
For Eon, oh, it's the same peptide.
Okay.
Yeah.
That patch activates a peptide. You will not hear David talk about it because of the other things that it does, and you will just don't want to be without it. I'm just telling you.
Yeah, like when I mentioned that, excuse me, that it increases your SOD, your superoxide dismutase, and your glutathione, and those all, you know, really powerful antioxidants in the body. He'll tell you it does a whole lot more. There's that just by blood tests that we've done. The good stuff that's increased are the right chemicals that will do wonders for many disease processes and for overall health. So obviously he cannot get into the specifics of that, but just know that it does a whole lot more than we're saying.
All right, Pauline, quick question.
Okay. I think I understand this, so I think I'll just repeat it and tell me if I'm right. you said that inflammation is a detractor to the stem cells. So by adding the Aeon, that's where we increase I mean, already the X39 is doing wonderful things, but it can do better with the Aeon as well, because then it's not fighting all that other inflammation. Is that where we're
That's
at? On that?
correct. Yes,
Okay.
because your stem cells are going to be attracted to any inflammatory process in the body to come and help out. But the out of control inflammation is going to sort of like kill your stem cells, right? Decrease your stem cell activity. So if we're controlling the inflammation with the Aeon, then we're allowing the stem cells to do
Even better, quicker.
even better. Mhm.
Okay. Okay. Thank you.
More, better, faster.
All right, Kaleo, did I say that right?
Not quite, it's Kelly Jo.
Kelly Jo, I'm so sorry. Oh my gosh.
That's all right. My first question is, if somebody is using X39 and Eon all the time, and the chronic inflammation in their body is still bothering them after, say, almost a year, is there something that they should be, another patch or anything that they maybe should be adding? Or is the fact that they're using X39 during the day and Eon at night, maybe they should be using them together during the day? Or how would you handle that? What would you recommend to that person?
Well, there's different things. Every case is very specific and different, but yes, you can always experiment and say, well, let's see what happens if I wear them both together or away from each other. You can start there. The first thing that comes to mind to me is that this person may, first of all, don't stop. That's not a reason to stop, right?
Right.
That's the first thing. Just continue, because it's not that the patch is not working. The patch is working, but there's it's busy. It's doing a lot of stuff. There's a lot of stuff, reconstruction happening. So I need to allow for that. That means there's a lot of damage that this person has done to themselves, right? So need to allow for that reconstruction to start. And then what things can I do in my lifestyle, choices that I make that will help me support what the patch is already doing? So then hydration is really important, especially for inflammation. Hydration is really important. I would look at my diet, because if there's this type of chronicity and inflammation, then I'm probably eating some foods that are adding to that inflammation process. There's some foods that will increase the inflammatory process in the body, and there's foods that are going to help me decrease inflammation as well. So I would do those things. The regular things that we do, am I including some movement to the degree that I can go for a 10-minute walk or something, and get my fluids moving and all of that. Most importantly, something that's even more important than everything was with what I started, mindset. What's happening in those 6 inches between your ears, right? What's going on there? And start looking and doing things, first of all, becoming aware of my thought patterns. And I would make it a priority to feel good. Find anything. The easiest way is to find things. My mentor used to say, think about what you're thinking when you're thinking it. And if it doesn't feel good, change it immediately. That's what you need to do. Become aware of your thoughts. We think so much all the time. So many thoughts go through, and we don't even realize how negative they are. 90% of what we think is negative. 90% of what we're thinking is exactly the same thing that we thought about yesterday. Okay, we're not that creative. We're just recycling all thoughts and attitudes. So then that is a game changer right there. When you get someone, how can I become a factor of cooperation in my own healing Well, very simple. I'm going to become aware of how my thoughts feel. And then anything that doesn't feel good, I'm going to move away from that immediately. And I'm going to focus my attention on anything that makes me feel even a little bit better. And right there, with between those things, that would start generating some changes right there.
Okay. Okay.
Twigs.
And then the second question that I have, if you don't mind me asking a second one, is, are there any specific tests that we can have our doctors do to measure how things have changed for us?
Well, yeah, there's inflammatory markers like C-reactive protein. There's other ones that are indicators of inflammation in the body. Yeah, that can be done. That has been done. I think, let me see if I can, I think I have a here something that right here, let me tell you.
Perfect, thank
This is
you.
from the research, that the clinical studies in samples of blood, urine, and saliva that were tested with Aeon. And it decreases your C-reactive protein. That's one of the things in blood. Fibrinogen is another level. Homocysteine, which is another level marker of inflammation in the body, and lipid peroxide levels. All of those were drastically decreased in the body in urine, saliva, and blood in the clinical studies with Aeon.
Perfect, thank you.
Mm-hmm.
I love it. Twigs, question.
Wow, Dr. Dolly, you have just given us some fabulous, powerful information. Thank you today. We really appreciate what you brought to us. It's excellent. I do have a question. I always wear my Aeon here on my right hand because I'm out and about and I want to talk to people. But when I broke my leg, I actually was wearing the Aeon on my right hand, and I also put it down by my broken leg. So was there, just out of curiosity, is it wrong to wear 2 Aeon patches if I'm, because I want to keep this up here so I can share with people, but I wanted to make sure, well, I just did it regardless. I wore 2 Aeon patches, put it down by my leg and up here. What's your thoughts on that, Dr. Dolly?
I love it. I do the same thing. If I have an injury or something like that, then I always wear mine below my belly button. And then I'll put the other one either in the point of pain or the injury site. That helps get better faster. Mm-hmm.
Nice. Well, thank you so much. You were powerful today. We loved your information.
Thank you, Twigs.
All right, Dharma, we will let you ask the last question. What is your question for Dolly?
First of all, thank you, Dr. Dolly. Can you hear me?
Yes.
Okay, thank you very much. I needed to hear all of that today. And my question is, if I have some people who are dealing with cancer and still in treatment, and they're worried that whatever this stuff, magical stuff does is, not going to work with their treatment, and then so far everybody says, well, have them ask their doctor if it will, and the doctors don't know about this. They look at it like it's hocus pocus mumbo jumbo, and they say, well, you can do what you want, but we're not recommending it. So how do I navigate that to build their confidence? And is it even appropriate to start this while they're still in chemo?
Medical questions are for medical doctors, for the doctor that is tending to that specific patient.
Mm-hmm.
So all you can say, is if you have any questions, you can take this information to your healthcare practitioner, have them review them. Maybe you're going to have to educate them on it somewhere, and then take it from there. Now, I know you, Dharma, so we know that we are surrounded usually with patients and clients that are more empowered about taking their own health in their own hands and making decisions, and being informed. So the power is in the patient, right? What they're willing to do or not do once they're informed about anything. We cannot go into treating, diagnosing, or recommending any product for any specific condition. So this is a personal journey, and the person has to either take the bull by the horns or not. So that's all I can say about that.
Is there any contraindicative knowledge a place to find any contraindicated knowledge as to this and chemo?
So what I
And-
always encourage people to do is go out to the website, reverseagingwithghk.com. Reverseagingwithghk.com. Dr.
Okay.
Lawrence Hart, phenomenal scientist, phenomenal doctor. He's done some of the clinical studies for LifeWave, and he has done extensive research on the GHK-Cu copper peptide. And I encourage them go out and look at his site and see how important it is to get that peptide activated. Now, if they are dealing with a diagnosis, some that start with the letter C, I tell them do a search on that, because he talks about that diagnosis on that website, and let them go do research for themselves, because they have to come to a belief and know that this is a direction that they want to go for their well-being and health. So
That's
send them to
perfect.
that website. Yeah,
Charity, thank you. That's what I needed, that link.
perfect.
Can you repeat that website one more time?
Reverseagingwithghk.com. Reverseagingwithghk.com.
Thank you.
Okay, Nikki, we have like 2 minutes. So what is your quick question for Dr. Dolly?
Well, I don't necessarily have a question for Dr. Dolly, which is kind of a response to Dharma's, the question that she just had. So my son was diagnosed with brain medulloblastoma specifically last year. And I brought the patches and patent and the studies from Dr. Picard, which is who Charity is talking about, to the integrative medicine team. When I'd asked his regular normal oncologist, they wouldn't give me a good response like I wish that they did. And so they would just say, let's get you in contact with integrative medicine. So that is who they should speak to, and just let them know and get them that information. I, from both teams at the University of Minnesota and at Children's, got the A-OK that my son could use this during treatment. Now that was my son and his doctors, so he'll have to go talk to his team, but that might be a good place to start, is to refer and get to speak with that integrative medicine team.
Fantastic. That was a nugget that you heard today on our Q&A. Thank you, Nikki. All right, I'm going to share my screen here, and we're going to pull up, see, I remembered. Let me just hang on a second. So David will be on in 6 minutes. So if you take a screenshot of this link, you can type that into your browser and click on it, and you can hear him. He's talking about the X39 and the Alavita today. You can also find it back in our library, and I will show you here in a second. Show you where the library is at, back here in the Patched Up Information Center. Right there we have it, that you can click on the link there. So with that being said, it has been an absolutely amazing day. Dr. Dolly, thank you. I hope all of you have seen a bigger picture of why we coupled those two together. We will never be without them. And you know what? Let's just go change more lives, reach more people. And we will see you tomorrow night, X39 launch in the evening at 8 Central with some more powerful testimonies. And thank you, Dr. Dolly, for coming. We love you all. Have a fantastic week. See you all soon.
Thank you, thank you, thank you.
Thank you, everyone.